Hi there, this is Matthew Price from Scripps Clinic in La Jolla, California, and we're going to discuss complex PFO closure today. So what is a complex PFO? Well, I look at it as classifying PFO into 5 characteristics. One's with a long rigid tunnel, one's with a thick septum secundum, one's with an aneurysmal septum, one's with a combination of those characteristics, and one's without any of those characteristics at all. And really the first 4 there I would define as complex PFO. And when there's none of those characteristics, that's a simple PFO. So I will talk a little bit. I think that the Cardioform Septal Occluder has some unique characteristics that make it amenable to complex PFO closure. That is PFOs with these characteristics. And there's some very simple technical approaches you can use. So first, in terms of technical approaches, when you have one of those characteristics of complexity, what do you do in terms of sizing? Very simple. One of the easy things about the Cardioform Septal Occluder sizing matrix is that there's really only 3 sizes. 25 is your go-to. If you have any of those characteristics I mentioned, you should just upsize to a 30. Okay, and that makes your life very easy. And there are really 4 steps. One is to identify that the PFO is indeed complex, to select a 30 millimeter occluder device size, to incorporate specific maneuvers during the deployment of the device in the setting of those characteristics, and finally confirm an acceptable anatomic result. And I do think we'll talk about each of the characteristics that the Cardioform has some specific characteristics that are nice in those situations. So this is a patient of mine, 41, MCA stroke, embolectomy. They do the TE, and you see here this really massive PFO. So there's clearly a very aneurysmal septum. There's a large gap, and I wonder as well if there's a fairly long tunnel or long flap here. You see a very markedly positive bubble study. Here's a procedure I brought the patient in. I did this with the new Philips 3D ICE catheter, 9 French through the right femoral vein. You get multiplane imaging here, like a TEE. And I always, when I go in, I reassess and make sure I'm not missing any anatomical characteristics that would make the case complex. And here I'm just confirming that there really is a very aneurysmal septum. This is not modest. There's a significant displacement during respiration. You see also there's a sense that there's a big separation of this flap. And also I just wonder how long that tunnel actually is. Does it go all the way to the back towards the aorta almost in this? That could add a layer of complexity. So certainly complex. Here what I've done now is invest my wire to the the left upper pulmonary vein, and exchange it out for an Amplatz extra stiff wire. I do this in all my cases because some cases that may seem simple, you put up that stiff wire and it really splays that PFO open, say more than 10 millimeters in diameter. Then you should really consider upsizing to a 30 millimeter device. In this particular case, it's about 10 to 12 millimeters. So certainly I think to have a level of safety to capture the septum, you're going to want to use a 30 millimeter device. And here's the case. So I have my catheter in the left atrium. You see here on the right, I'm slowly advancing the left disc to form the left disc. I'm kind of rubbing the back wall a little bit there. That concerns me a little bit. What I'll do here is clock the whole system to move it away, posteriorly away from the aorta, and continue. And now I've formed the left disc and pulled it back slowly until I'm nice and snug against the interatrial septum. So a couple of points here. One is that in order to, when you have big gaps, like here, by clocking the device, I'm coming in perpendicularly, so I won't pull through and miss the septum secundum. The major mode of failure with all PFOs, particularly complex ones, is not capturing the septum secundum. So you need to do that. Getting yourself orthogonal is important. The second thing is I believe the Cardioform is particularly nice for long tunnels because it's conformable and it's made out of petals that can independently interact with the interatrial septum. So I want to make sure I'm nice and snug here and really crumple up that flap. Now I have pulled back and formed the right disc. And the key thing is to confirm you have capture of that septum secundum. It's really rare not to capture the septum primum. So I call it the septum secundum sandwich right here between my 2 discs. It looks lovely. And on fluoro, you see that as well. You have separation of discs, no crossing of wires. And now I'm locking the device. One of the nice things about the Cardioform Septal Occluder is that once you've locked the device, much of the tension has been released because it's only connected to the catheter by a suture retrieval cord. So you see here that there's tension has been released after I lock it, and a metal cable, excuse me. Now that I've locked it, it's very flat. It's not being pulled down towards the IVC. You can get a real good idea of what things are going to look like when you release the device. If you don't like it, you can just retrieve it still now. So here I've confirmed I still have a septum secundum sandwich. You see how nicely the right atrial disc lays down because of the conformability of the pedals, despite the fact that it was a pretty long tunnel. Here's the final results. Looking great, and no bubbles at all. So this is a big success. So final thoughts. So at the start of the procedure, inspect the PFO and the septum for signs of complexity, long rigid tunnels, aneurysmal, thick septum secundums, or a combination thereof or thereby. If complex, upsize to a 30 millimeter device. I also think if you have any of those characteristics, the Cardioform device performs very nicely. It splays nicely because it's soft. It conforms even in the setting of a long tunnel, so you won't have one disc propped almost orthogonal to the plane of the interatrial septum. In borderline cases of an atrial septal aneurysm, you can put a stiff wire across. You should put a stiff wire across always to advance your delivery sheath. And if it really splays open the device well, you should just upsize to a 30 millimeter. So with that, I will leave you and have a great day or evening. Thank you very much.